Kia ora everyone, I'm Dr. Taisia Huckle, one of the Alcohol No Ordinary Commodity Author Group. I work at the Shaw and Whareiki Research Centre, Massey University, New Zealand. Alcohol's harm to others refers to the second-hand effects of alcohol or the harm that drinkers cause to others. Harm to others is still an emerging research paradigm, so we don't have the 50 to 60 years of evidence that we do as per the drinker. However, if adequately assessed, harm to others would likely represent a large contribution to overall harm from alcohol use. How can we understand alcohol's effects on harm to others? What this diagram shows is that the drinking patterns and the mechanisms of harm, that is intoxication, toxic effects, and dependence, are the same for drinkers and the harm they cause to others. This diagram is important for a couple of reasons. First, it enhances our understanding of how drinking relates to acute and chronic harm to others. Second, it suggests that many of the same prevention and intervention efforts that work to reduce harm for drinkers should work to reduce harm to others. How can we understand the burden of alcohol's harm to others? Well, we can't quite yet. We don't know the total burden of mortality or hospitalizations for harm to others globally or for individual countries in the same way that we do for the drinker. Harm to others is largely not yet included in global burden of disease estimates, and valid indicators appropriate for these types of comparative assessments are needed. Further, harm to others is not documented in ICD codes or health or police datasets, making it hard to objectively document, and of course a lot occurs behind closed doors. What we do know is that harm to others is wide-reaching. That is, it affects a lot of different areas. Key areas of health affected include death, injury, violence, traffic crashes, fetal alcohol spectrum disorder, and child maltreatment. Harm to others reaches interpersonal violence, harm in the family, economic impacts, and there's social problems related to harm to others also. What we know about the health burden of harm to others in relation to deaths and hospitalisation includes that 13% of traffic crash deaths are due to another's drinking globally. This varies by country and by gender. In terms of death and disability adjusted life years or DALYs, these are higher among women compared to men. 15% of deaths due to violence are attributable to another's drinking. Between 50 to 80% of homicides are related to a perpetrator who was drinking. And while studies on hospitalizations are rare, one study found that 45% of hospitalizations for assault were due to another's drinking. Children are a very important population in regard to harm to others, especially as they are not able to remove themselves from the situation of harm. FASD is one of the areas in harm to others where we do have good meta-analytical studies. We have strong evidence of effects. We know that FASD is a leading cause of preventable intellectual and neurodevelopmental disability, and it's 100% attributable to others drinking. The table shows the prevalence of FASD by World Health Organization region. The prevalence of FASD is highly related to the prevalence of drinking during pregnancy, and there is variation by WHO region. Another key area of harm to others that affects children in terms of health and mental health is maltreatment. Around 25% of child maltreatment deaths can be attributed to another's drinking, and that the evidence generally shows that alcohol use, and particularly very heavy alcohol use or abuse by caregiver, is related to child maltreatment. Violence is a key social problem related to alcohol harm to others. It's complicated in the sense that although intoxication is an important causal factor in violence or interpersonal violence, there's no clear distinction between perpetrator and victim, and often both parties have been drinking. This complicates the assessment of violence attributable to someone else's drinking. Nevertheless, research shows that considerable amounts of violence and sexual assault are related to a perpetrator who's been drinking. These proportions or percentages may be lower in countries that do not have substantial alcohol consumption. With respect to intimate partner violence, the percentage varies depending on the severity of harm, but we do know that alcohol consumption increases the likelihood of intimate partner violence, and more so for perpetration by males. With respect to harm to others in the family, women and children bear much of this burden. Harms to women come largely from male intimate partners and family members, and harms to men more often come from male friends, distant relatives, and acquaintances. Men are also more likely than women to report that their drinking causes harm to others. The economic costs from others' drinking are large. They've been estimated to be similar in magnitude as the costs that drinkers impose on themselves. One study that estimated the cost of harm to others in Australia estimated this at nearly $20 billion Australian dollars. There's also a range of social problems that's related to harm to others. I'm just going to talk about a couple here today, but one of these is subjective health and well-being. So subjective quality of life and health are lower among those who have a heavy drinker in their life, and this perceived loss of well-being is similar to those who care for people with a disability. Diminished access to neighbourhood amenities and public space are commonly reported harms to others in the literature, and this is true for both low middle income countries and high income countries. This means that people go out of their way to avoid intoxicated people or where they drink. The impact is not equal, with harms being greater among women, younger people, and in socially deprived communities. So what can we do to reduce harm to others? Well, the evidence available to date, with the caveat that it's still relatively limited compared to what we know for the drinkers themselves, indicates that the same prevention policies and interventions for the drinker will work to reduce harm to others. So here I'm talking about best buys, increase excise taxes, ban or regulate alcohol marketing, restrict availability of alcohol, drink driving laws and enforcement, which is an important area for harms to others, and brief intervention. And we do have studies that show that alcohol policy restrictions can affect violence and homicide. So to very briefly sum up, despite the challenges, and emerging research literature has begun the work of estimating alcohol's role in harm to others. Much of the evidence of the health burden of harm to others comes from high-income countries, and this is related to data availability. And there is an urgent need for more research on the health burden of harm to others, including in low and middle income countries. Global burden of disease estimates are needed to provide a more complete picture of the burden of drinking to inform decision making and strengthen policy on alcohol control. Thank you.